Doctor explains how seniors should drink water to support blood sugar and diabetes health. It might sound incredibly simplistic, almost too good to be true, but what if a profoundly powerful tool for effectively managing your blood sugar isn't something found in a meticulously formulated prescription bottle, nor is it a complex dietary regimen that demands strict adherence and constant sacrifice. Instead, imagine it residing in something as fundamentally simple yet persistently overlooked as the precise timing and method of your daily water intake. Many people, upon hearing this, might instinctively react with a degree of skepticism. After all, I've been drinking water my entire life, they might reasonably think. How could something so basic, so ingrained in daily existence, possibly hold the key to significantly improving my diabetes management, especially when so many other interventions have fallen short? This natural skepticism often stems from a history of trying countless solutions that promised transformative results, but ultimately failed to deliver. Perhaps it was a parade of expensive supplements that had no measurable impact, or restrictive diets that felt utterly impossible to sustain in the long term, or well-intentioned advice that sounded perfectly logical, but simply didn't translate into consistently better blood sugar numbers on the glucose meter. However, I urge you to stay with me and consider what I am about to share, because for hundreds of my patients, individuals who meticulously followed every conventional piece of advice and still found themselves locked in a frustrating battle, this specific approach to hydration has made a genuine, quantifiable, and often life-changing difference. My name is Dr. Williams-Thompson, and throughout my years in practice, I have witnessed firsthand the profound despair and exhaustion experienced by patients who were doing everything right, yet continued to struggle with unpredictable blood sugar levels, persistent fatigue, and the constant anxiety accompanying every A1C result. Today, I am going to reveal the exact mechanisms through which proper hydration timing and specific additions to your water can dramatically improve your body's insulin sensitivity by an astonishing margin of up to 40%. The people I speak of are not abstract figures from medical textbooks or hypothetical case studies. They are real individuals, many in their 60s, 70s, and beyond, who faithfully take their medications without ever missing a dose, meticulously follow intricate meal plans, measure every single portion of food, check their blood sugar multiple times a day with diligent precision, and even maintain a consistent morning walk routine. Despite all these commendable efforts, their blood sugar numbers often remain stubbornly unpredictable, leaving them feeling profoundly exhausted, perpetually worried, and utterly bewildered by their body's seemingly defiant response. The frustration that I observe daily in my practice is not merely academic, it is deeply personal and heartbreaking. These are individuals who have been engaged in a relentless battle against diabetes for years, sometimes even for decades. They've invested substantial financial resources in specialized diabetic foods, made immense personal sacrifices by giving up beloved foods, and diligently adhered to every single directive from their healthcare providers. They are, quite simply, tired of the incessant vigilance required to manage their condition, tired of the pervasive feeling that they are somehow failing, despite trying harder than anyone else they know, and tired of the constant emotional toll that diabetes exacts. My extensive clinical experience has taught me a crucial, often counterintuitive lesson. Sometimes the most profoundly powerful medical interventions are not the most technologically advanced or complex ones. Frequently, it is the fundamental, foundational aspects of health that we have completely overlooked, perhaps deeming them too rudimentary, that ultimately create the most significant and measurable differences in patient outcomes. Recent groundbreaking studies emerging from highly respected major medical research institutions have now unequivocally demonstrated something truly remarkable. Consuming water at very specific, strategic times throughout the day can significantly enhance your body's insulin sensitivity by up to 40%. This isn't merely a small percentage point improvement. It means your body becomes substantially more adept and efficient at utilizing the insulin it possesses, whether that insulin is naturally produced by your own pancreas or administered through medication. The critical insight, therefore, isn't solely about the sheer quantity of water you drink daily. It is, perhaps even more importantly, about when you choose to drink it, how you consume it, and even what you strategically add to it. Small, targeted, and consistent adjustments in these hydration parameters have been shown to yield substantial and sustainable improvements in overall blood sugar control. Before we delve deeper into these specific methods, I'd genuinely love to hear from you. Where in the world are you currently watching this from? Please take a moment to drop your country or city in the comments section below. I find it incredibly inspiring to see how widely this vital message travels across continents, and it serves as a powerful reminder to all of us that the challenge of managing blood sugar is a truly universal one that we are navigating together as a global community. It is absolutely imperative to clarify from the outset, this comprehensive hydration strategy is emphatically not intended as a substitute for your prescribed medication, nor should it ever lead you to disregard your doctor's professional medical guidance. Rather, its fundamental purpose is to provide your body with the foundational cellular level support it critically needs to function with optimal efficiency. By doing so, it enables your existing medications to perform precisely what they were designed to do, but within a physiological environment that is significantly more conducive to their efficacy. To truly grasp the profound impact of these hydration strategies, let me first illuminate what is progressively happening inside your body as you naturally age. Understanding these underlying physiological shifts makes the entire framework I'm presenting make complete and undeniable sense. After the age of 60, in particular, several significant and interconnected physiological changes begin to manifest, collectively making blood sugar control genuinely more challenging, even for individuals who are diligently adhering to every recommended health practice. Firstly, your cells, over time, gradually develop an increased resistance to insulin. This means that the crucial receptor sites on your cells, which are responsible for binding with insulin and allowing glucose to enter, become less responsive or efficient. Consequently, when insulin attempts to deliver glucose into these cells for energy, the process is slower and less effective than it once was. This cellular deafness to insulin forces your pancreas to work harder, producing even more insulin to achieve the same effect. Secondly, your pancreas itself, the vital organ responsible for producing insulin, doesn't operate with the same efficiency as it did in your younger years. The beta cells within the pancreas, which are specifically tasked with insulin production, can experience age-related fatigue and a decline in function, leading to a reduced output of this absolutely crucial hormone circulating within your system. So you're essentially contending with two compounding factors: cells that are less sensitive to insulin and a pancreas that is less capable of producing it efficiently. Thirdly, your kidneys, which play a critical role in filtering waste products, including excess glucose, from your bloodstream, may also become less effective with age. This reduced filtration efficiency means that surplus sugar tends to linger in your bloodstream for longer periods instead of being promptly eliminated, contributing to elevated blood sugar levels. And here lies perhaps the most critical insight, a point that is frequently overlooked by a significant number of people, including even many healthcare providers. Your brain's intricate thirst mechanism becomes markedly less sensitive with advancing age. This final point is not merely important, it is absolutely pivotal to understanding age-related blood sugar dysregulation. You can, quite literally, be substantially dehydrated, even dangerously so, without experiencing any discernible sensation of thirst whatsoever. Your mouth might not feel parched, and you might not experience any obvious physical discomfort or dry throat. However, beneath the surface, at the intricate cellular level within your body, a silent cascade of suboptimal processes is unfolding. Even mild dehydration, representing a mere 2% deviation below your optimal hydration levels. A state that is often barely perceptible to you subjectively can be enough to elevate your blood sugar by a significant 10 to 15 points. This seemingly small increment can, quite frankly, be the critical difference between maintaining genuinely good blood sugar control and sliding into a frustrating state of poor control. It's often enough to meticulously explain those perplexing morning spikes that appear out of nowhere, or those unexpected afternoon highs that defy all logical dietary explanations. This age-related blunting of the thirst mechanism is a silent assailant, making consistent, proactive hydration absolutely essential. Allow me to illustrate this point with the compelling story of a patient named Gerald. He was 68 years old when he first walked into my office, and even before he had settled into his chair, I could clearly discern the profound frustration etched across his face. "Dr. Thompson," he began, his voice taut with a mixture of despair and exasperation, "I genuinely don't understand what I'm doing wrong. I'm eating so carefully, meticulously measuring every single portion. I take my metformin precisely as prescribed, without fail. I walk 3 miles every single morning, a routine I never miss. I've completely eliminated all sugar and white bread from my diet. I've followed every piece of advice you and my other doctors have ever given me." He then pulled out a small, well-worn notebook, its pages densely filled with an intricate log of blood sugar readings. "Look," he urged, pointing to the columns of numbers. "Some mornings it's 145, other mornings it's 185. Yesterday morning it was 162, but this morning it's 178. And this is with the same breakfast every single day, the exact same steel-cut oatmeal, the same carefully measured portion. The numbers are simply all over the place, and I have no idea why." His wife, sitting quietly beside him, added with a soft, concerned voice, "He tries so incredibly hard, Dr. Thompson, but despite all his efforts, his A1C has just kept creeping up from 7.1 to 7.9 over the past year. It's just so disheartening to witness." We methodically reviewed Gerald's entire routine, scrutinizing every detail. His diet was excellent, truly exemplary. His medication timing was perfect. His exercise regimen completely consistent and regular. On paper, everything appeared absolutely impeccable, textbook perfect. Then I posed what seemed, at the time, like an almost trivial and unassuming question. "Gerald," I asked gently, "could you please walk me through your entire morning routine from the very moment you wake up until you sit down for breakfast?" He began. "I get up around 6:30 a.m., check my blood sugar immediately, then I make coffee and drink it while reading the news on my tablet. Then, around 7:30 a.m., I prepare my oatmeal and take my medication with a glass of water. I then ask the crucial follow-up, 'When do you drink plain water, Gerald?'" He paused, genuinely confused by the simplicity of the question. "When I'm thirsty, I suppose," he replied, a hint of uncertainty in his voice. "Sometimes with my medication pills. Is that wrong?" There it was, the profound, yet subtle, oversight. Gerald was going from 6:30 a.m., or even earlier, until 7:30 a.m., or sometimes even later, before consuming any actual plain water. This meant 8 continuous hours of sleep without any fluid intake, followed by another full hour or more awake, active, and consuming dehydrating coffee without proactively hydrating. This amounted to a staggering 9 hours or more of progressive dehydration each morning. We implemented remarkably simple, yet strategically impactful changes to Gerald's routine. Every single morning, before he even considered making his coffee, he began by drinking 1 full glass of warm water infused with a tiny pinch of natural sea salt and the juice from half a fresh lemon. Additionally, 15 minutes prior to both his lunch and dinner meals, he committed to drinking another glass of room temperature water. To ensure consistent hydration throughout the day, he started carrying a reusable water bottle and made a conscious effort to sip from it regularly and consistently. Just 2 weeks later, I received a phone call from Gerald at my office. His voice on the other end of the line was completely transformed, lighter, filled with a palpable sense of relief and almost outright excitement. "Dr. Thompson," he exclaimed, "my morning readings have consistently been between 125 and 138 for the entire past week, every single day. This level of consistency hasn't happened for me in over 2 years. A month later, his average fasting glucose had plummeted by an impressive 22 points. There had been absolutely no changes to his medication regimen whatsoever, solely water, meticulously timed and strategically consumed. "I honestly thought you were a little bit crazy, to be frank," he admitted, with a genuine, beaming smile at his follow-up appointment. Water seemed far too simple, too basic to actually matter in such a significant way, but I simply cannot argue with my glucose meter. The numbers absolutely, unequivocally do not lie. Before I reveal the specific step-by-step method that has consistently helped my patients achieve these remarkable kinds of results, it's essential to understand the 3 most common hydration mistakes I consistently observe in my practice. There's a very high probability that you, like many others, are currently making at least one, if not more, of these crucial errors. Mistake number 1: waiting until you're thirsty to drink. Many people mistakenly perceive thirst as an early warning system, a gentle nudge from the body. However, thirst is emphatically not an early warning signal. It is an alarm bell, a physiological distress signal that typically only activates after you are already significantly dehydrated. By the time your mouth feels genuinely parched and dry, a cascade of suboptimal events has already begun within your body. Your blood has already started to thicken, becoming more viscous. Your glucose levels have already elevated due to this concentration effect. Your kidneys are already working harder to process the diminished fluid volume, and your insulin, the very hormone tasked with managing your blood sugar, is already struggling to function with optimal efficiency within a denser, less fluid environment. Think of your blood not merely as a liquid, but as a vital river, continuously carrying essential nutrients, including glucose, to every single cell throughout your vast and intricate body. When this metaphorical river is full, flowing smoothly and adequately hydrated, glucose can easily and efficiently reach exactly where it needs to go, into your cells for energy. However, when this river runs low due to insufficient hydration, it becomes thick, sluggish, and slow-moving. Glucose molecules become metaphorically stuck within this viscous current. They accumulate in your bloodstream instead of being effectively delivered to the cells that desperately require them for metabolic energy. This leads to higher, more persistent blood sugar levels and increased cellular stress. Mistake number 2: drinking large amounts of water all at once. It's a common pattern. Many individuals go for hours, even a significant portion of their day, without consuming any water, only to suddenly attempt to catch up on their hydration by guzzling a huge, overflowing glass. While the intention is good, this approach is largely ineffective and often counterproductive. Your body has a finely tuned absorption capacity for fluids. It can only effectively absorb approximately 200 to 250 milliliters, which is roughly equivalent to 1 standard cup, every 15 minutes or so. Anything beyond this specific volume, consumed rapidly, will largely bypass your cells and pass straight through to your bladder, resulting in frequent urination without actually achieving true cellular hydration. It's an analogy that might resonate. Consider watering a houseplant. If you dump an entire bucket of water onto it all at once, the vast majority of that water will simply run off the sides of the pot, overflowing and draining away, leaving the plant's roots largely dry and unhydrated. Conversely, if you water the plant slowly and steadily, providing smaller, consistent amounts over time, the soil gradually absorbs the moisture, and the roots receive exactly what they need to thrive. Your body's cells function similarly, requiring a steady, gentle supply of water for optimal absorption and utilization. Mistake number 3: drinking ice-cold water, especially first thing in the morning or immediately before meals. I understand the appeal. Ice-cold water can feel incredibly refreshing, particularly on a hot day or after physical exertion. However, from a physiological perspective, especially concerning blood sugar management, consuming ice-cold water, particularly at critical times like first thing in the morning or right before eating, can actually be detrimental. When you ingest very cold water, it causes a reflex constriction and narrowing of your blood vessels, particularly those in your digestive tract and periphery. This vasoconstriction is a physiological response designed to conserve core body heat. When your blood vessels narrow, insulin, which needs to travel through your bloodstream to reach your cells, has a significantly harder time circulating effectively and reaching the cellular receptor sites that desperately need it for glucose uptake. The delivery system becomes compromised. In contrast, room temperature or slightly warm water helps to keep your blood vessels naturally relaxed and optimally dilated. This relaxed state allows insulin to circulate freely and work far more efficiently, ensuring its unimpeded delivery to your cells. This subtle difference in water temperature is especially critical during the morning hours, when your body is naturally experiencing higher cortisol levels and preparing for the day's metabolic demands, and also around meal times, when your body is actively engaged in processing and managing incoming glucose. Now, let me introduce you to the specific, actionable method that I consistently employ with my patients, the strategy that has yielded such impressive and consistent results. I refer to it simply as the H3 method. The H in H3 stands, quite obviously, for hydration. The first 3 in the method's name represents the 3 key timing points throughout your day when strategic hydration is most impactful. The second 3 signifies the 3 essential elements that are crucial to making this entire approach genuinely effective and transformative. Let's begin by systematically exploring the 3 critical timing points. Timing point number 1, first thing in the morning. This is, without exaggeration, your single most important and impactful hydration timing point of the entire day. The very moment you wake up, before you reach for your coffee, before you consider breakfast, even before you check your phone or engage in any other daily activity, make it an absolute priority to drink 1 full glass of warm water. Aim for approximately 350 milliliters, which is about 12 ounces. Here's where the crucial additions come into play. Stir in a truly tiny pinch of natural sea salt. And when I say tiny, I mean genuinely minuscule. Just the amount that would fit precisely on the very tip of a butter knife. Additionally, squeeze in the fresh juice from about half a lemon. Why these specific, seemingly minor additions? Consider what your body has just undergone. 8 full hours of sleep. During this period, you haven't consumed any fluids, and your body has naturally lost water and electrolytes through essential nocturnal processes like respiration, breathing out water vapor, and perspiration, even subtle sweating during sleep. That small, precise amount of natural sea salt serves a vital purpose. It provides a balanced array of essential electrolytes, including sodium, potassium, and magnesium. These minerals are not just beneficial, they are absolutely critical cofactors that actively help your cells absorb and effectively utilize the water you're drinking, rather than simply allowing it to pass straight through your system. The lemon, meanwhile, contributes valuable vitamin C and antioxidant, and creates a subtle acidity that, once metabolized, helps stabilize your body's complex blood sugar response to your very first meal of the day. This deceptively simple morning ritual achieves something profoundly remarkable within your body. It acts as a gentle, yet powerful signal to your adrenal glands, prompting them to calm their activity. Your adrenal glands naturally produce cortisol, often referred to as your body's primary stress hormone, which typically peaks every morning upon waking. This morning surge of cortisol specifically instructs your liver to release its stored glucose, glycogen, into your bloodstream, providing an immediate energy boost to help you awaken and face the day. However, in individuals with compromised insulin sensitivity, this natural morning glucose release can lead to an undesirable and often frustrating blood sugar spike. By proactively calming this natural stress response with proper hydration and a strategic mineral balance, you effectively mitigate and often prevent that unnecessary morning blood sugar elevation. Let me share the story of Elizabeth, a 72-year-old patient who had been diligently managing type 2 diabetes for 14 years. Her single biggest, most persistent frustration was her stubbornly high morning blood sugar readings. She would consistently wake up to numbers around 165 or 100 175, despite having eaten a carefully measured, low-carbohydrate dinner the previous evening and having a perfectly acceptable bedtime blood sugar reading. We initiated just one singular change to her routine: warm water with a small pinch of sea salt and fresh lemon juice, first thing every morning, at least 20 minutes before she even thought about her coffee. 3 weeks later, her average morning blood sugar reading had dropped significantly to 128. Her medication dosage remained unchanged. Her evening routine was identical. The only difference was how she intentionally started each day. "I wake up feeling genuinely different too," she enthusiastically told me at her follow-up appointment. "More clear-headed, less foggy and confused, and that consistently lower morning number gives me a profound sense of confidence and positive momentum for the entire day ahead." Timing point number 2, before meals. Approximately 15 minutes before you sit down for both lunch and dinner, make it a habit to drink a smaller glass of plain water, aiming for about 150 to 200 milliliters, which is roughly 1 standard cup. This seemingly inconsequential habit performs several crucial physiological functions that are highly beneficial for blood sugar management. Firstly, it effectively prepares your entire digestive system for the incoming meal. It stimulates the production of salivary enzymes and stomach acid, optimizing the initial stages of digestion. Most importantly, from the perspective of blood sugar control, this pre-meal water slightly dilutes the contents of your stomach. This dilution directly contributes to slowing down the rate at which carbohydrates are broken down and absorbed into your bloodstream. When carbohydrates enter your bloodstream in a slow, gradual, and controlled manner, rather than in a sudden, rapid rush, your body's available insulin can more effectively keep pace with the demand. This allows your blood sugar to rise gently and steadily after a meal, avoiding dramatic, sharp spikes that put immense strain on your pancreas and exacerbate insulin resistance. Clinical studies have compellingly demonstrated that this remarkably simple pre-meal hydration habit can reduce post-meal blood sugar spikes by an impressive margin of up to 20%. For many individuals living with diabetes, this difference is often the critical factor between struggling with frustrating blood sugar fluctuations and successfully maintaining genuinely good, consistent metabolic management. Timing, point number 3, during physical activity. If your daily routine includes any form of sustained physical activity, whether it's a brisk walk, engaging in gardening, performing household chores, or any other movement that lasts for more than 20 minutes, it is absolutely imperative that you drink water during that activity, not merely afterward when your body is already in a state of depletion. Aim for approximately 100 to 120 milliliters of water every 15 minutes of sustained physical exertion. The key here is to take small, frequent sips rather than attempting to gulp down large volumes all at once. Consistent hydration during activity is crucial for several reasons. It helps to maintain stable blood volume, which is essential for efficient nutrient and oxygen delivery to working muscles. It also plays a critical role in preventing the undesirable blood sugar fluctuations that commonly occur with physical exertion in individuals with diabetes. When the body is adequately hydrated, it can regulate glucose more effectively, mitigate stress hormone responses, and ensure that cells receive the necessary fuel without dramatic shifts in blood sugar levels. Dehydration during exercise can exacerbate these fluctuations, leading to both potential lows, hypoglycemia, or unexpected highs, hyperglycemia, as the body attempts to compensate. Now that we've covered the 3 critical timing points of the H3 method, let's explore the 3 essential elements. The second 3 that underpin the effectiveness of this entire approach. Element number 1, temperature matters. As previously discussed, the temperature of your water plays a far more significant role than most people realize. Room temperature water, typically between 22 to 24 degrees Celsius, roughly 72 to 75 degrees Fahrenheit, or even slightly warm water, is demonstrably optimal, particularly when consumed first thing in the morning and before meals, while cold water isn't inherently bad in all contexts. Its physiological impact on your circulatory system can be less than ideal for metabolic health. Warm water, in contrast, consistently helps to keep your blood vessels naturally relaxed and optimally dilated. This state of vasodilation allows for dramatically better and more efficient insulin circulation and delivery throughout your body. Insulin, a protein hormone, relies on the unimpeded flow of blood to reach its target cells. When blood vessels are open and relaxed, insulin can more easily bind to its receptors and facilitate glucose uptake. This seemingly small difference in water temperature compounds significantly over time, contributing to sustained improvements in insulin sensitivity and overall metabolic efficiency. Element number 2, minerals matter. The idea that pure, demineralized water alone is sufficient for optimal hydration is a common misconception. While water is undoubtedly essential, your cells require the presence of specific minerals or electrolytes to truly absorb and effectively utilize water at a cellular level. Without these minerals, water can pass through your system without effectively hydrating your cells, much like the houseplant analogy. That tiny yet crucial pinch of natural sea salt added to your morning water provides precisely these essential minerals. Natural sea salt, unlike highly processed regular table salt, which is often chemically stripped of its beneficial trace minerals and heavily refined, contains a full spectrum of naturally occurring electrolytes, including sodium, potassium, and magnesium, in their proper and biologically balanced ratios. These minerals are vital for maintaining osmotic balance, facilitating nerve impulses, muscle function, and countless enzymatic reactions, all of which are interconnected with blood sugar regulation. Choosing unrefined sea salt or high-quality Himalayan pink salt ensures that you are providing your body with the comprehensive range of minerals it genuinely needs for optimal cellular hydration and function. Element number 3. Consistency matters profoundly. Your body, being an incredibly complex yet highly adaptive biological system, absolutely thrives on predictable routines and rhythmic regularity. Consuming water at consistent, predetermined times every single day plays a pivotal role in helping to regulate your entire metabolic system. Establishing a routine of drinking your warm water with salt and lemon at the same time each morning and your pre-meal water at regular intervals before lunch and dinner signals to your body that a predictable pattern of hydration and metabolic support is being established. This consistency directly contributes to stabilizing your blood sugar patterns over extended periods. Regularity in hydration helps to maintain stable blood volume, support kidney function, and ensure that all enzymatic and hormonal processes, including those involved in glucose metabolism, operate within their optimal parameters, leading to more predictable and manageable blood sugar levels. Beyond the core H3 method, there is one more highly beneficial addition that I consistently recommend for virtually all of my patients, particularly those over the age of 60. Approximately 1 hour before going to bed each night, drink one final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium is an absolutely crucial mineral, a cofactor in over 300 enzymatic reactions in the body, and it plays a particularly vital role in proper insulin function and glucose metabolism. Unfortunately, the vast majority of people over 60 are clinically deficient in this essential mineral. Taking magnesium before sleep serves a powerful dual purpose. Firstly, it is a natural muscle relaxant and calming agent, helping your muscles to release tension and promoting deeper, more restorative sleep. Adequate, high-quality sleep is, in itself, a critical component of blood sugar regulation. Secondly, and directly relevant to diabetes management, magnesium helps to keep your blood sugar significantly more stable throughout the entire nocturnal period. It supports insulin signaling and glucose uptake, preventing those often perplexing overnight blood sugar fluctuations that can contribute to elevated morning readings. In my practice, one question arises with unfailing regularity. Doctor, precisely how much water should I actually be drinking each day? While individual needs can vary based on activity level, climate, and health conditions, here's a simple, practical, and highly effective formula to establish your baseline daily water intake requirement. Take your current body weight in pounds and divide that number by 2. The resulting number, expressed in ounces, represents your approximate baseline daily water intake requirement. For instance, if you weigh 160 pounds, your daily requirement would be approximately 80 ounces. To put that into more familiar terms, 80 ounces is roughly equivalent to 10 standard 8-ounce cups. If you consistently engage in regular exercise, spend substantial time in warm or hot weather conditions, or have a physically demanding job, you should augment this baseline by adding 1 additional cup of water for every 20 minutes of physical activity or significant heat exposure. How do you accurately ascertain if you're consistently drinking enough water without overhydrating or remaining subtly dehydrated? A simple and highly effective indicator is the color of your urine. It should ideally be a pale yellow, strikingly similar in shade to a diluted lemonade. If your urine is completely clear, almost colorless, it generally indicates that you are actually overhydrated, which can dilute electrolytes. Conversely, if your urine appears dark yellow or amber, it serves as a clear and unmistakable signal of dehydration, indicating that your body requires more fluids. The pale yellow hue is the optimal target, signifying balanced and effective hydration. To facilitate the practical implementation of this hydration strategy into your daily life, I recommend a straightforward approach. Acquire a reusable water bottle that holds approximately 24 ounces. Make it a habit to fill this bottle completely 3 times throughout your day, once in the morning after your initial warm water ritual, once at midday, and once again in the afternoon. This simple routine ensures a total intake of 72 ounces, which is an excellent baseline for most adults. The key is to keep this bottle constantly visible. Place it prominently on your kitchen counter, on your work desk, within easy reach in your car, or wherever you spend the most time. Visual reminders are profoundly more effective than simply trying to mentally remember to drink water, especially when your brain's thirst mechanism may be less reliable with age. You might also consider setting gentle reminders on your phone or linking water intake to existing habits, such as refilling your bottle every time you take a break or move between tasks. So, what should you realistically expect when you consciously begin to implement the H3 method? What changes can you anticipate in your body and your blood sugar management? In the initial week of adopting this new hydration routine, it's highly probable that you will feel like you are making frequent, perhaps even constant, trips to the bathroom. This is a completely normal and entirely expected physiological adjustment. Your body is simply recalibrating, flushing out accumulated toxins, and adjusting to consistently proper hydration levels. This increased frequency of urination typically settles down significantly by the second week as your body adapts and achieves a new fluid balance. During this initial period, you should begin to notice your morning blood sugar readings starting to stabilize, perhaps averaging 10 to 15 points lower than your previous baseline. While this may not represent a dramatic overnight transformation, it signifies consistent, measurable improvement. The kind of progress that builds confidence and momentum. By weeks 2 to 3, you should start to experience noticeably more stable and sustained energy throughout your entire day. You'll likely encounter fewer of those frustrating afternoon energy crashes or bouts of mental fogginess. Your post-meal blood sugar readings should also become substantially more predictable and consistent, reflecting your body's enhanced ability to manage glucose influx. By week 4, if you routinely check your A1C, glycated hemoglobin, you might observe it beginning to trend downward. Again, this might not be a huge, instantaneous drop, but there will be clear, discernible movement in the right direction, a testament to the cumulative positive effects of consistent hydration. And perhaps the most common and deeply gratifying feedback I receive from my patients at this stage is a simple yet profound statement. Doctor, I just feel genuinely better. I can't quite explain it precisely, but I feel more like my old self again, more vibrant, more clear-headed, more energetic. That is precisely what proper and consistent hydration creates. It is crucial to reiterate that this method does not cure diabetes, nor does it replace necessary medications. Instead, it serves to profoundly support your body, enabling it to work the way it was naturally designed to, optimizing its inherent metabolic capabilities. Let me be absolutely unequivocal about something of critical importance. This hydration approach is in no way, shape, or form a replacement for proper medical care, professional advice, or prescribed treatments. If you are currently taking diabetes medication, it is paramount that you continue to do so without interruption. If your doctor has established a specific management plan for your condition, you must continue following it faithfully and diligently. What this strategic hydration method accomplishes is to powerfully support your existing medication regimen, making it function significantly more efficiently and effectively within your body. I have had patients who, after 3 consistent months of diligently applying this method, were able to reduce their medication dosages, but always under their doctor's careful, watchful supervision. This was not because water replaced medicine, but because their body's entire metabolic system began functioning more optimally, requiring less pharmacological intervention to achieve the same or better results. There are also specific considerations to bear in mind. If you have any degree of kidney disease, it is absolutely essential that you engage in a direct, in-depth conversation with your physician before substantially increasing your water intake. For the vast majority of people, this hydration approach is completely safe and highly beneficial. However, if your kidneys are not filtering properly, an excessive increase in fluid intake could potentially be harmful, and you require individualized professional guidance tailored to your specific condition. Similarly, if you are currently taking blood pressure medication, it is important to pay close attention as you increase your hydration. Proper hydration can naturally contribute to lowering blood pressure, which is, in many cases, a genuinely beneficial outcome. However, this beneficial effect might necessitate adjustments to your blood pressure medication dosage. Watch carefully for any symptoms of dizziness, lightheadedness, or sudden drops in blood pressure, and report these to your doctor immediately so that your medications can be appropriately managed. Let me conclude with the story of Dorothy, who was 74 when we first met. Dorothy had been courageously managing diabetes for an arduous 19 years. Her journey included multiple medications, various restrictive diets that demanded immense willpower, and numerous diabetes education classes at the hospital. She possessed an understanding of carbohydrate counting that surpassed that of most registered nutritionists. Yet, despite her unwavering diligence, her A1C had been steadily creeping upward, reaching a concerning 8.6. Her endocrinologist was now seriously discussing the initiation of insulin therapy, a prospect that filled Dorothy with profound dread and a sense of defeat. "I feel like I've completely failed," she confided quietly, her voice trembling slightly. "I've done absolutely everything right for 19 years, but my body just keeps getting worse and worse. Maybe this is simply what happens. Maybe I can't fight it anymore." Her hydration habits, however, were, by her own admission, terrible. She would consume maybe 3 or 4 small glasses of water daily, if that. Her fluids consisted mostly of coffee in the morning and tea in the afternoon, but actual plain water was a rarity. "I never feel thirsty," she explained, a common refrain among older adults. "And honestly, I hate constantly using the bathroom. It's embarrassing when I'm out with friends." We embarked on the H3 method together. I openly acknowledged that for the first week or so, she would indeed need to use the bathroom more frequently, but I assured her with confidence that her body would adjust within 10 to 14 days, settling into a new equilibrium. 6 weeks later, when she walked into my office, she looked noticeably younger. Her eyes were brighter, her skin appeared healthier, and a genuine smile played on her lips. "My numbers have been the absolute best they've been in 5 years, she announced, proudly presenting her meticulously kept glucose log. "My average used to hover around 185 to 205. Now I'm consistently between 145 and 165. My doctor actually reduced one of my medications because of this. But for Dorothy, it wasn't just about the numbers on the meter. I have genuine energy again," she emphasized. "Real, sustained energy throughout the day. I can think clearly without that constant brain fog that used to plague me. I even started gardening again, something I had completely given up on 2 years ago because I simply lacked the stamina. 3 months later, her A1C results came back, a remarkable 7.3, down from 8.6. "You gave me my life back," she declared, tears streaming down her face. But these were tears of profound joy and gratitude. "With water," she added, still in disbelief. "Something that costs virtually nothing. I just wish someone had explained this to me 19 years ago when I was first diagnosed." Dorothy's incredibly moving story is precisely why I dedicate my time to creating and sharing these educational videos, because there are literally thousands of people out there, just like her, who are struggling right now, trying so incredibly hard, feeling utterly defeated and hopeless, when sometimes the answer is genuinely simpler, more fundamental, and more accessible than anyone could possibly imagine. I want to extend a personal challenge to you, the viewer, to try this practical, impactful approach for just 14 days, a mere 2 weeks. Follow the H3 method exactly as I've meticulously outlined it. Morning water with sea salt and lemon first thing upon waking. Water 15 minutes before both lunch and dinner, ensuring proper daily water intake consistently spread throughout the day, and magnesium water before bed. During those 2 weeks, diligently track your blood sugar levels and consciously pay genuine attention to how you feel, not just the numbers, but your overall well-being. Notice if you experience more sustained energy, clearer thinking, and better quality sleep. If, after these 2 weeks, you observe real, measurable improvement in your numbers and your overall well-being, then please keep going. Make this your permanent new normal, a cornerstone of your daily health regimen. And if you do try this method, please make sure to leave a comment below telling me what you noticed, what changes you experienced. Your personal story might be exactly what another person, feeling desperate and searching for hope, needs to hear to give this simple yet profound method a serious try. If you made it all the way to the very end of this video, please take a moment to type "I watched till the end" in the comments section below. It genuinely helps me understand that this crucial message is reaching people who truly need it, and it also significantly helps the YouTube algorithm share this vital information with an even wider audience of people who are struggling with blood sugar management. After typing "I watched till the end," please also tell me, are you going to try the H3 method? What is your biggest struggle with staying consistently hydrated? Share your thoughts and experiences in the comments. I personally read every single message. If this information was genuinely helpful and valuable to you, please consider sharing it with someone you know who is struggling with their blood sugar, a parent, a spouse, a close friend, or anyone who could genuinely benefit from this simple, practical, and effective strategy. And if you haven't already, please hit that subscribe button and turn on notifications so you never miss future videos on managing diabetes, improving metabolic health, and living well with chronic conditions. Thank you for being here, for your engagement, and for taking your health seriously. Always remember, small strategic changes, when implemented consistently and diligently over time, create genuinely measurable and profoundly transformative results. Take care of yourself. This is Dr. Williams Thompson, and I'll see you in the next video.